cardiovascular changes, there are two areas, well, the cardiovascular system is tremendously affected by pregnancy, and we need a lot of those changes simply to be able to supply this extra human being. And the other one is our joints and musculature, and we'll talk about that in a minute. So here I have my little heart up here. The arteries carry the oxygenated blood away from the heart, and the veins, which this is the vena cava, the big vein, we'll talk about that one specifically, carry the deoxygenated blood back to the heart so it can get pumped to the lungs and gather up oxygen. Circulation, like I said, almost doubles in size. That is not dependent on how far pregnant you are. That is a hormone effect, which means it happens almost right away. The hormones of pregnancy relax the blood vessels out to make space for all that extra blood that you're going to have by the end of the pregnancy. So there's my little blood vessel, and it literally it doubles in size, which means your tank is bigger almost right from the start. 1/5, now this is by the end of the pregnancy, 1/5 of everything that the heart puts out every minute goes to the uterus. Those uterine arteries are literally the size of garden hoses, and this is frankly in the olden days, not so much anymore, how women died. If we can't control bleeding, if the uterus doesn't clamp down, we have exactly 5 minutes before all of your blood volume, 5 times 20% is 100%, before all your blood volume has left your body. So it's pretty impressive the amount of blood that goes to, and the amount of circulation that goes to the uterus. Again, as we get into the 3rd trimester, the uterus acts like a tourniquet around our waist. Now that's one of those things that is not quite so nice. If you think about it, if I stick a tourniquet on my arm, from here down things start to swell and veins start to pop out. And if I put a tourniquet around my waist, guess what? Everything from here down starts to swell and veins start to pop out. So we get swelling, we get hemorrhoids, which are varicose veins in a not very pleasant area. We get a lot more vaginal discharge as a result of that pressure. It puts us at risk for blood clots. Blood sits around too long, it congeals and it forms a blood clot. We faint. Why is that? Well, if all the blood's down here and none of it's going around up here and the brain's not getting enough blood, that's called passing out. Pregnant women faint a lot. It's very common, and the first thing anyone asks when a woman passes out is, "Oh, are you pregnant?" Anyway, and then there are lots of other interesting symptoms in the hoo-ha. So women will tell me, "I can feel my pulse down there." Yes, you can. They will tell me they have something that looks like a small brain, which are varicose veins in the labia. The hyperkinetic heart. So how does our poor little heart that remains the same size and has supplied just my body suddenly supply an entire extra circulation that's really substantial? The hormones of pregnancy, again, the same ones that relax out those blood vessels, make the heart hyperkinetic. What that means is little teeny stimulus in, great big response out. Inotropic means force. The heart beats more forcefully, so no, it is not a figment of your imagination. That's real because the heart is beating harder. The heart also beats faster, chronotropic effect, that's time. Your resting heart rate increases when you're pregnant, and that's so that we can get blood to this extra circulation. So don't panic. And the reason I say that is these two things create a sense of panic when they happen. When your heart is beating more forcefully and more rapidly, that creates a sense of anxiety for a lot of us. It's a normal part of pregnancy. It settles down again about 5 minutes. That's what it takes. If you relax, stop what you're doing, it should settle back down again in about 5 minutes. Oh, the lazy blood vessels. They're not really lazy. They're really actually just kind of doing what they're supposed to be doing, which is making extra space for all this blood. Beware. When the blood vessels can't constrict down, there are certain things that our body really has trouble with. The heat. When you go outside about 5 or 10 minutes, your body starts to try to sweat. And the way that we cool our body off when we start to sweat is that we dilate those already dilated blood vessels. Okay, we were like this, now we're like this, now suddenly we're like this. Dilates those blood vessels up even more so that you can radiate off the heat. Well, if you take that space and make it like this and then suddenly make it like this, it drops the pressure out. And guess what? You're going to swoon. You're going to feel like you're going to pass out. Changes in position. Every time we change our position, every time we move against gravity, there are all kinds of little connections, little receptors that tell our heart, hey, the brain says, hey, you just got up and I'm not getting enough blood, do something about it. Well, the heart beats more quickly and the call goes out to the blood vessels to say, hey, scrunch down, push more blood up here. Well, the blood vessels can't do that. The call goes out and they go, and that's it. So changes in position, especially in the third trimester, if we've got a lot of blood stuck down here, pregnant women stand up and can pass flat out. Dehydration. So a little bit of a low tank in that great big tank, even a little bit of dehydration goes a long way. This is classic in the morning. You haven't been drinking overnight. You get up in the morning. You are already behind. You are already dehydrated. So the first thing you want to do actually in the morning is get up and drink a couple big glasses of water or juice or something and fill your tank. The worst thing you can do is stand up, be dehydrated, and then go get in a nice hot shower. Because guess what? And you're going to go to ground. So, so hydrate, hydrate, hydrate. The fuller you keep that tank, the less it matters if things are sequestered in places where we can't really use it. So what do? Well, we exercise. Exercise is wonderful. Exercise helps especially get the blood back to the central circulation. Blood moves forward actively. It's being pumped by the heart. Return of blood to the heart is a passive thing. It requires the movement of the muscles around those veins to literally squeeze the blood back up to your heart. So movement, and I know, of course, Aunt Minnie is going, oh no, dear, you need to sit and you need to put your feet up. No, you don't. Actually, you need to be walking and moving around and using these big muscles to squeeze that blood up. Work again, we talked about. Lots of us nowadays have desk jobs. It's the single worst thing for a pregnant woman to sit and have two bends, and it's all uphill. Every 20 or 30 minutes, you actually want to get up and walk around. Use those muscles, get that circulation moving. And by the way, doing this, blood is still not going to flow against gravity, so that really doesn't help. The magic of laying on the left side. If you can, so if this is, for how many people is this your first baby? Okay, a lot. Those of you who are fortunate to not have, someone kind of clinging to you immediately when you get home, one of the things I tell my ladies is go home before you touch the dishes, do the laundry, do anything else on your left side. The left is magic because the big vein that drains everything runs along our back on the right. So the big artery is over here, the big vein is over here. It's just as flimsy as all the little veins. Okay, it's big, but it's not very stout. So what the left side does is literally what I'm doing is I'm rolling the uterus off that vein and I'm opening it back up. So we lay down all the way on the left side so your belly is laying on the bed, and then you wedge a pillow between your legs because if we get the leg higher than the heart, gravity will also help get that blood back. And then, okay, 10 minutes, turn over, other side, all the way over, and wedge that pillow in there again. And that really helps get things back to the central circulation.